Sliding hiatal herniation, also known as type 1 hiatal herniation, along with the subsequent development of gastroesophageal reflux disease, are common health issues in brachycephalic dog breeds. Brachycephalic breeds are those with shortened muzzles and flattened faces, and their popularity has been on the rise, especially the French Bulldog, which is currently the most popular breed in the United States. This increased prevalence underscores the need for better methods to diagnose and treat both sliding hiatal herniation and gastroesophageal reflux disease in these beloved companions. Sliding hiatal herniation can be diagnosed non-invasively using a procedure called swallowing fluoroscopy. This technique allows veterinarians to see the intermittent displacement of the junction between the esophagus and the stomach through the opening in the diaphragm where the esophagus passes. However, this method can sometimes produce false negative results, and it doesn't provide information about the nature or how often gastroesophageal reflux disease occurs. Management of these conditions often involves medications that suppress acid production and drugs that help with the movement of food through the digestive system. In some cases, surgical correction of the brachycephalic obstructive airway syndrome, a condition common in these breeds that affects their breathing, or surgery to address the laxity of the hiatus, the opening in the diaphragm, may be considered. Unfortunately, the response to medical therapy or surgery can vary considerably, and it can be difficult to objectively assess how well a treatment is working when relying solely on the clinical signs observed by pet owners. The clinical signs of sliding hiatal herniation and gastroesophageal reflux disease in dogs can range from subtle indicators like lip smacking or frequent swallowing to more noticeable signs such as obvious regurgitation, difficulty swallowing, or repeated episodes of coughing that can occur if food or water is inhaled into the lungs. Sometimes, pet owners may misinterpret these signs, perhaps thinking they are normal for the breed or confusing regurgitation with vomiting. To overcome this subjectivity, an objective diagnostic tool like pH monitoring could be very useful. This technology can help assess gastroesophageal reflux disease in brachycephalic dogs with sliding hiatal herniation, link reflux events to the clinical signs reported by owners, and evaluate the effectiveness of different treatments. This study demonstrates that Bravo pH capsule technology is a valuable tool for documenting and quantifying acidic reflux in French Bulldogs with sliding hiatal herniation. The finding of higher esophageal acid exposure in younger dogs and during the day is noteworthy. The study also provides preliminary evidence suggesting that surgical correction of brachycephalic obstructive airway syndrome can improve acidic reflux in some affected dogs, although further research with larger sample sizes is needed. Despite its costs and the specialized expertise required, Bravo pH capsule technology offers a more objective approach to assessing and managing gastroesophageal reflux disease in brachycephalic dogs with sliding hiatal herniation.